Hello, my name is Delicia Wilson Ball, and today I will be presenting my proposal for an outreach program for elderly depression in El Paso, Texas, in cooperation with the El Paso Behavioral Health System. The name of the program will be the Outreach Program for Elderly Depression, or OPED for short. Depression is one of the most common mental health problems facing older people, and it often goes unrecognized and undertreated because the symptoms get discounted as just part of the aging process. Depression is more common among elderly people living in residential facilities due to poor physical health, social isolation, and loss of loved ones and friends. So why is this a public health problem? Studies on depression indicate that approximately 3.8% of the population experiences depression. For people over 60, that number rises to 5.7% according to the World Health Organization. Studies show that chronic conditions not only lead to depression, but depression can be the cause of some chronic conditions. Elderly depression results in emotional suffering, increases in healthcare costs, suicide rates, and mortality rates. Late life depression puts people at higher risk for strokes, stroke-related death, heart disease, dementia, and other cognitive-related health concerns. Depressed older adults score below normal in tests involving verbal fluency, response inhibition, problem solving, cognitive flexibility, memory, and/or ideomotor planning. The factors leading to elderly depression are individual etiologies such as personal attitudes and motivations, social group factors such as lack of support due to loss of loved ones or feelings of isolation, socioeconomic factors such as poverty, education, access to health care, civil strife and discrimination, and political factors such as cuts in Medicare and Medicaid spending that can result in older patients not seeking the care that they need in fear of creating medical bills or a financial burden on their family. The potential partner organization for the evidence-based program exploration is El Paso Behavioral Health System located in El Paso, Texas. It is a private psychiatric hospital specializing in mental health, chemical dependency care, and military behavioral health. In addition, they offer a senior program that helps older people struggling with mood disorders, drug or alcohol use, or other behavioral health changes. In exploring best practice programs, there is the Creation Health model that focuses on providing holistic faith community nursing intervention to decrease depression scores. There is also a music program in Taiwan that uses music therapy to improve depression among the elderly in nursing homes. And lastly, there is a program in Beijing, China that uses positive psychological intervention to target community-dwelling adults with mild cognitive impairment. The core of OPED is to educate older people on how the body follows the mind, focus on the importance of reflection and finding meaning and purpose in life, and promoting group activities to combat loneliness. We propose using social cognitive theory and theory of planned behavior in implementing OPED's intervention programs, as it is important that elderly people can express their concerns individually as well as find a sense of belonging in a group setting. Individual therapy-based sessions will apply theory of planned behavior. Community-based education services will apply social cognitive theory, and senior fun days will combine both. The proposed program design will incorporate two Healthy People 2030 goals, as both goals align with the outreach program as they encourage adults to seek help if they are experiencing symptoms of depression and encourage physical activity to combat depression. The components of OPED will include a 6-month program in cooperation with El Paso Behavioral Health System, retirement homes and senior living facilities, as well as some recreational and activity centers. We will also offer individual therapy sessions, community-based education services, and sponsor weekly senior fun events. In evaluating the success of OPED, we will use the Geriatric Depression Scale Assessment in each activity to determine the participants' depression score at each visit. We will track participants' depression scores at the beginning and end of the program. We will track attendees of the sessions and maintain records of how many are reaching out to providers for help managing their depression. And lastly, we will track active participants, the activities they participate in the most, and collect verbal feedback from participants at the end of the event. The logic model indicates that the inputs needed for OPED will be funding through government grants, trained and licensed staff members, partnerships with retirement homes and senior living facilities, as well as recreational and activity centers. The long-term impacts we hope to see are a decrease in depression scores, increased physical activity, and an increase in the number of older adults who seek treatment. In conclusion, addressing elderly depression requires a multifaceted approach for understanding the causes, impacts, and contributing factors of elderly depression. Ultimately, the goal of OPED is that elderly people continue to be productive, contributing members of society, and that those who need help are educated on the resources to obtain the help they need. Thank you for your time, and should you have any additional questions, please email me.